My research area is endocannabinology. My own story is now in its seventh year of keeping myself alive with CBD oil, and while my peers are getting older. I'm getting better. It's my duty to share the experiences and observations I have gathered on this journey of discovery. Where else can I do this but in this international forum where people understand what I am talking about, where I can feel like I'm among like-minded professionals. Our approach is based on holistic thinking. The indissoluble triad of body, mind, spirit. The focus of endocannabinology is on inner balance, which was previously understood differently. The concept of homeostasis has been known for a long time, and each era has tried in its own way to describe it in its entirety. Today, however, we have to admit that a relativized approach is much better at getting to the heart of the matter than covering up the missing parts by speculation. We now know enough to admit that there is much more in the world that we do not yet know. This modesty is a greater aid to our learning than anything we have ever known. Our journey of discovery leads us through many marks, but we are also increasingly able to answer more of the questions we had before. We can reinterpret what we already know. Homeostasis, placebo, nocebo, communication, deciphering spontaneous healings are all very exciting questions that we can now answer scientifically in a different way than we did in previous decades. It also represents a paradigm shift that has been decades in the making. Materialism can finally be replaced by a scientifically sound wave nature paradigm. We no longer think that there are alternative therapies that patients could possibly take because for a patient it is not an alternative whether or not they get cured. The optimum for them may be some individual integrative system. The previously prevalent concept of complementary medicine is also incomplete, as it has been a kind of relegated secondary role for a variety of valuable methods with roots going back thousands of years. Integrative medicine, unlike all the previous overly cautious platforms, is finally getting to the heart of the matter. We represent it. We want a medicine where patients can more consciously experience the benefits that we can deliver through integrated methods. Where our humanity is our primary concern and not the interest of the money market determine of the depths of what we can talk about. Where we can build science not according to the interest of bankers, but create driven by a passion to seek the truth. Where we are not afraid of what is human, because we know that it enables our existence. We all know that faith in healing itself is a value to the exploited, and to recognize it, education and example are needed first and foremost. We need to be made aware of how we create our reality and thus build our health. For more than 2 decades, I have been using symptom questionnaires that can be subjected to biometric analysis. What was once brushed aside as a subjective factor is now an actively usable component of evaluations. In the same way, I use meridian balance measurements to monitor the state of internal balance. The roots of analogy thinking also go back thousands of years, but without it, we would not be here we are in technological development. It was through my recovery from my illness that I came to my first, very shocking, extreme measurement results, which I interpreted to develop an evaluation system. I have used measurement data from hundreds of healthy and sick people to define criteria of evaluation. But I would not have made any progress if I had not already been well versed in Mongolian, Tibetan, and Chinese traditional medicine, homeopathy, detoxification methods, and Orientalist diagnostics. I would like to contribute to this joint work by trying to familiarize my colleagues with this simple methodology, which finally gives us simultaneous insight into the processes in our bodies that affect our inner balance. If we use this model, we will soon no longer need randomized, placebo-controlled, double-blind trials to say with certainty what kind of treatment is conducive to recovery, to regeneration, and how it leads in its untangled way to a person's recovery. I want not only to understand and describe the endocannabinoid system, but also to mimic its creative capacity. I seek to use the rapid feedback to correct the direction we believe is leading us towards healing. But it is not just about healing. It's also about developing health. Those who are healthy can be healthier, and those who are healthier will have access to their childhood abilities again. We can imagine what a wonderful world this could mean for humanity. I would like to see a time when many people can answer that. Thank you for your attention.